What's up guys? Welcome back to my channel. I am the House Hacking Mom, and today's video is going to be all about what it is actually like to breastfeed as a first-time mom. This video is going to follow your breastfeeding journey chronologically, so right after your baby is born all the way up to when you're pretty much getting the hang of things around 1 to 2 months. And this is based off of my experience as a first-time mom. My baby is now 9 months old, so I still very freshly remember what it was like to breastfeed for the very first time. So if you're interested in knowing what exactly can I expect as a first-time mom breastfeeding, keep watching. And at the end of the video, I'm going to talk about a resource that I think is super important. So if you want to see that resource, make sure you stay to the end of the video. So right after my baby was born, I had very high expectations for myself and breastfeeding. I knew a lot of breastfeeding moms. I'm actually a registered nurse, so I knew all the really great health benefits that come with breastfeeding. So right after she came out, they put her skin to skin, and I'm trying to figure out what exactly I'm supposed to do here. And it didn't happen as easily as I expected. I put her to the breast and she just kind of didn't really seem like she knew what to do. She wasn't really able to latch. And, the nurses are saying, oh, don't worry about it. Just give her some time, give her a couple hours. And they kind of left. And although I am a registered nurse, my specialty is adult critical care. So this is not my personal forte, newborns. So, I'm in the hospital bed, I've got my baby and my husband, and everyone else has kind of left. And I'm thinking, oh my goodness, my baby is not eating. It took a lot of tries. Finally, she latched, and oh my goodness, it hurt so bad. You probably heard before that breastfeeding is painful, and it's absolutely true. Obviously, this is one of the most sensitive parts of the female body, and yeah, it hurt. It hurt pretty bad. A tip that was helpful for me that I got from one of the lactation consultants at the hospital, as far as that pain goes, it really should only hurt really badly, that toe curling pain, for the first several moments, those first couple sucks when the baby is trying to latch. And then after that, it will still be painful, but it should kind of ease up. That really sharp pain should kind of go away if the baby is latched properly. And you can watch all sorts of videos, see all sorts of diagrams of what a baby's mouth should look like if they are latched properly. Their lips should be flanged outward. You should not see their lips curled in while they are on the breast. If they are, oh my word, that is super painful. So definitely expect it to hurt. Anyone who tells you that, oh, if it hurts, you're not doing it right, I'm sorry, that's absolutely false. It will hurt really badly the first several days, and then it starts to dramatically decrease. And then I would say by about the second week, it doesn't hurt at all anymore. So when your baby is first born, you may have heard the timeline, oh, a baby should eat every 4 hours. That is not really true. What should actually be happening is as soon as you put your baby to your breast and they start to feed, you should start a timer, and 2 hours from when the baby starts feeding, you should be offering for them to eat again. It's not every 4 hours. You want to be feeding them between 8 and 12 times in a 24-hour period, which works out to about every 4 hours. So that's where that comes from. But newborns take forever to eat. They're not good at it. It takes them a long time to kind of figure out what they're doing. It might take them 5 to 10 minutes to even really get going. So if you set your timer for 4 hours, you're never going to get enough feedings in a 24-hour period. So start your timer as soon as your baby starts eating for 2 hours from when they start. And usually that way you're going to make sure you get plenty of feeding time in. Something else I did not realize as a first-time mom is how much help a newborn needs to figure out how to breastfeed. I definitely thought that, oh, this is natural. The baby should be able to figure this out. They have the sucking reflex and all those sorts of things. If I just put my baby in the right position, they should be able to figure it out, no problem. I think there are babies that exist that are able to do that, but that is not common. And my baby struggled particularly. She had a small tongue tie. It wasn't enough to where she needed a procedure to fix it, but she naturally, clearly did not know what to do. I had to help her a lot. And that's something I didn't expect. I think I thought I was gonna be able to just kind of do this and sit back and relax. My baby was just gonna eat, and that's not what it's like. You put your baby in the position and they turn their head, they can't quite figure out what they're supposed to do, they look around, they can't seem to find your nipples sometimes. It takes a lot of work to help your baby to breastfeed, especially I would say those first 4 days. So just have your expectations there, and it will reduce the frustration you're going to have. If you go into it realizing this is going to take a lot of effort, but it will pay off long term. Some things you can do to help is to try to have your partner or maybe your mom or someone you're really comfortable with to really help you get the baby to latch. You know, you kind of hold your breast in the correct position, which you should not hold it between your fingers like a cigarette. You should be holding it like a sandwich and kind of compress it so the baby can get their mouth around it. Basically, you're gonna start rubbing your nipple on the baby's lips, trying to get them to open their mouth, because the baby automatically won't open their mouth. And then as soon as the baby opens their mouth, you need the other person to kind of push the baby onto your breast. And then you can kind of get your arm under their head and kind of settle down and relax. As far as your baby latch goes and the pain is concerned, the most painful part is the latch, right? So the frustrating part for a baby who's not latching very well is that every time they pop off, when you bring them back to help them to latch again, you have that same sharp, painful sensation again. And every time they pop off, you will have to deal with that again and again and again. So that was super frustrating. No matter how tight I held her, or even if I held my breast the whole time in the exact perfect position, even if she was latched perfectly at the beginning, she would pop off constantly. She would pop off all the time. So that just caused me to do this a lot. And so I started having lots of pain up here in my shoulder, in my neck, and it just caused a lot of anxiety around feeding my baby, which was not good. But, you know, we stuck with it. We got better at it. I got better at asking people to help me. And eventually she was able to stay latched. Remember to relax, put your shoulders down, and just prop yourself up with lots of pillows. Make sure you have a nursing pillow. I will link my favorite one below. I've talked about it a lot in my other videos. You can check them out. Another thing you can do is try side-lying nursing. This is something I was not really able to figure out until further on down the road because we just struggled so much. We can do it now, but side-lying nursing is something that some moms are able to do right away, and it helps them to relax, and their babies are able to do it right away. So that's something you can look up and try. So let's say it's been 24 hours after your baby is born. The key thing that most people are looking for is to make sure that your baby is peeing and pooping. And the rule of thumb is they should pee and poop at least once within that 24 hours after the baby is born. And then the rule of thumb after that is you add 1 pee and 1 poop for every day of how old they are. And really, guys, that is the bare minimum. That is like the threshold that keeps them from having to stay in the hospital. If they're not reaching those goals, you know, the nurses and the doctors are going to get very concerned. You really would prefer your baby to start to be peeing more. And, you know, it's going to be a darker yellow at first, but it should very quickly clear up and become more of a clear pee. You should be changing your baby's diaper several times a day. And then by day 5, 6, you should be changing it 5, 6, 7 times a day. Every single time you nurse, probably within the first 3 to 4 days, you're going to feel an intense cramp sensation in your uterus, and that is because when you nurse, it releases a hormone that tells your uterus to clamp down, which is great. It will help reduce your likelihood of bleeding after delivery. Look who's joined us. So going on with those first couple days, around day 2 or 3, around day 2 or 3, you are going to start getting super engorged. And when I mean engorged, I mean you're going to feel like your breasts are coming up into your neck. They're going to get super hard, tender, very kind of sharp needle feeling, sort of like your foot falling asleep kind of sensation. What helped me pretty much was just to put ice packs on it. I would just take packs of frozen peas or corn, and then I would just put them right up here on my chest, and that made it feel so much better. And while you're breastfeeding your baby, while you're super engorged, you just want to make sure that you are compressing that breast tissue enough so that the poor little baby can get their mouth around it. She definitely struggled, but we were able to get through it, weren't we, baby? Were we able to get through it? Yes, yes, yes. Mwah. In that first several weeks, how long will your baby nurse for? Well, your baby is probably going to nurse for at least 20 minutes, if not all the way up to 30, 45 minutes, and sometimes even an hour. Now, I expected my baby to start nursing and then just suck the whole time, just suck the whole time. And that's not what they do, or at least that's not what my baby does. They latch, and then they'll suck for a little bit, and then they'll rest, and then they'll suck for a little while, and they'll rest. And they might go a period of several minutes of being on your breast and not really doing anything. And you're like, are they done? Are they hungry? Should I pull them off? And really the answer is no. You want to keep your baby on your breast, skin to skin, nursing as much as possible, especially for those first couple weeks, because you're trying to help them to gain as much weight as possible. And you are literally teaching someone who has never eaten before how to eat. It's a very important skill that they need to learn right away. So when can you expect breastfeeding to get easier? Well, for me, it was a challenge and an effort every single time through about, I would say, 3 to 4 weeks. And then after that, it started to get significantly better. And then I would say around 4 months, it was no issue at all. It gets to the point where all you have to do is pull up your shirt, put your baby on, and they do the rest. It doesn't take any effort. It doesn't take any thought. You don't have to do anything extra. You don't have to pay any money for it. It is completely free. It's always the right temperature. You don't have to cart around bottles and formula with you. So if you can stick with it, there are so many benefits that come with breastfeeding. And the benefits for you are it will help reduce your likelihood of getting cancer, breast cancer specifically. It will help your uterus shrink down to the proper size a lot faster. It will help you lose your baby weight. This is just my personal experience, but without doing a lot of exercise, I did do some exercise because I had some diastasis recti and I had to kind of pull my abdominal muscles back together. But it helped me get back down to my pre-pregnancy weight by 7-8 months. I was back down to my normal weight. So it definitely works. And believe me, I was not dieting. I was probably eating more than I ever had before. The most important thing is that it is so good for your baby. It's great for the bonding experience. It helps reduce their likelihood of getting colic. It provides so many great things for their immunity. It helps reduce their likelihood of having allergy problems. And it doesn't mean, of course, that if you breastfeed, you won't have any of these issues in the future, but it will help significantly. So if you're going into breastfeeding thinking within the first week or two, it should be easy, no problem, that might be true for you, but I would not expect it. I think most of the time for first-time moms, even ones that are very educated on the topic like I was, it takes a while to get used to. And it also takes your baby a while to figure out exactly what they need to do in order for breastfeeding to not be an ordeal every single time. Now, a resource that has helped me a lot in my breastfeeding journey is this book right here called The Womanly Art of Breastfeeding. It is put out by the La Leche League, which is a group with a very good reputation. They know all about breastfeeding. They have lactation consultants. They have forums on Facebook that can give you all sorts of great advice. And I highly recommend that you get one and you at least skim it, if not thoroughly read it before your baby is born. And it speaks to all sorts of common problems that you could have with breastfeeding. It talks about engorgement. It talks about oversupply, undersupply, rashes that your baby might be getting, what things are safe to eat while you breastfeed, all sorts of things. This is pretty much the breastfeeding Bible. So I highly recommend that you get this book before you have your baby. So if you're an expecting mom or a first-time mom and you're considering breastfeeding, I highly recommend that you give it a try and that you give it a fair shot. You're not gonna know within the first week or even within the first 2 weeks necessarily if breastfeeding is right for you. There's definitely a learning curve for both you and your little baby. It takes time. And I'd like to do a series of videos around the topic of breastfeeding. So if you have any questions that you would like answered or any topics that you'd like to see covered in those videos, make sure you hit the like button, subscribe, and comment below so I know what to make those videos about. My name is Rachel. I'm the house hacking mom. I like to make videos about minimalist parenting, frugal living, and healthy eating. Thank you so much for watching. Bye. Bye-bye. Bye-bye. Mwah.